hardware disease, also known as traumatic reticuloperitonitis. The incidence has drastically decreased since the 1950s. In 1950, it was in around 80% of animals, but in the year 2000, it's only in 2 or 3% of animals. The cause is a sharp metallic object, like a nail or a screw, and 99% of the injuries are in the reticulum. They rarely go and injure the abomasum, the duodenum, or the jejunum. The predisposing factors are no selection during eating, or incomplete mastication before swallowing. For the pathogenesis, a foreign body goes to the reticulum directly or to the rumen. So over the rumino-reticular fold, which is the cranioventral part of the reticulum, it then goes to the rumen. So if it's less than half a centimeter, it's silent. If it's half centimeter to 1 centimeter, they get reticulitis. And if it's over 2 centimeters, they get reticuloperitonitis. And if it's 10 centimeters, they can get pericarditis. The penetration can cause pain. And then this can cause reticuloperitonitis. Localized reticuloperitonitis can be acute or chronic. Acute can become chronic, or it can cause systemic signs. In chronic cases, it can cause adhesion, and then this will decrease forestomach movement. If it doesn't become localized, it can cause diffuse peritonitis. This is acute and has local or systemic signs. The secondary consequences are nephrosis, myocarditis, and arthritis. This is due to the toxins and bacteria. Further complications are traumatic pericarditis, pneumonia, and pleuritis. In the clinical signs, for the acute signs of penetration, their posture will change. They'll have a stretched neck and head, and they'll also have a tucked-in abdomen. Their behaviour will also change. They'll have a frightened glance, and they can have cautious or difficult movements. Upon auscultation, you'll also hear a grunt with a stethoscope above the larynx or trachea. And for digestion, they can also have the rumination affected. They can have no rumination or ruminatony, which causes small, firm, separated content. And they'll have less feces and it'll be poorly digested. For the chronic signs of penetration, they'll have decreased food intake and feces output, as well as decreased milk production. They'll have abdominal pain, but it will be less intense. They can also get Hoflund syndrome, where the right side of the body is penetrating outwards and the left side of the body is penetrating upwards. For their basic clinical values, their temperature can be from 39.5 to 40 degrees Celsius, and their heart rate can be from 80 to 100 beats per minute. And the respiratory rate will be over 30 breaths per minute, and they'll be shallow and costal. And in the case of pleuritis or pericarditis, they'll get a distended jugular vein, as well as submandibular brisket edema. And their temperature will be above 40 degrees Celsius, their heart rate will be above 90, and their respiratory rate will be above 30 breaths per minute, and it'll be shallow. For the clinical examination, you need to do the reticular pain probe. So grip their back, use a rubber hammer, and do the pole test where you pull a pole up underneath them, as well as the elbow knee test. When doing a blood test, you'll see increased neutrophils and increased fibrinogen and total protein. And for the treatment, give penicillin and oxytetracycline and ceftiofur. You can also use a reticular magnet. And for prevention, remove the foreign body or use a reticular magnet.